So how do you get hospitals and nursing homes as clients? Well, it depends on what you're selling. So if you're selling, let's say, a medical device or some kind of treatment or some kind of product that a clinician, doctor, nurse, has to use, you have to look at who is impacted the most by that particular product being implemented or purchased in the hospital or the nursing home. So obviously, if it's a doctor who needs to use the product, clearly, or a nurse, those clinicians are directly impacted, or a service, they're directly impacted by it. But the decision maker may not necessarily be them. It could be the chief medical officer or the medical director, depending upon, how big the hospital is or the nursing home. They may have this chief medical officer and a medical director. But those that are typically decision makers around like certain things, using that as an example. And if you're doing IT services, let's say in a hospital network and a nursing home network, typically the IT person may not be the decision maker, the one who's dealing with the hospital staff and all those kind of people on a day-to-day basis. It may be a chief information officer or a chief technology officer who's kind of more of a visionary person across the network and may realize that this product or service will help them be more efficient, save money, cut down potentially on staff, things of that nature. So you have to figure out who is the decision maker, but also who would be impacted the most by your product or your service. And you also have to remember that in healthcare, there are typically multiple stakeholders. So the larger the product or service that you're selling something at $25, $50, $100,000, $200,000, maybe $1 million, you're going to have multiple people involved in that decision, particularly at a higher level. So you got multiple stakeholders that need to kind of sign off on that. And in the healthcare sector, a lot of people operate in fiefdoms. This is my area. The administrators don't go into the clinical area. Clinical don't go into administration. People kind of operate in these silos. So you need to be able to kind of connect those dots to get those people to buy whatever product or service. And let me tell you something. It's easier to get a hold of them because they have titles, they have phone numbers, they're in a business-to-business environment. You can find out who they are and eventually get them on the phone and have a conversation, and do a Zoom, WebEx, set up a meeting, get their email. There's data available, to get that information. So they're out there and they can be found. The challenge, obviously, is getting to the right person so that you can pitch your product or service. So that's kind of how you can get in front of them, figure out who the decision maker is, who the influencer are, and who are the various people involved in a decision, so you can begin moving that sale forward.